Hey guys, welcome to Medifaction. Today, let's learn about radiation injury. Radiation is a form of energy that travels in the form of waves or high-speed particles. They are classified as non-ionizing and ionizing radiation. The energy of non-ionizing radiation such as ultraviolet, infrared, microwaves, and sound waves can move atoms in a molecule or cause them to vibrate, but is not sufficient to displace bound electrons from atoms. In case of ionizing radiation, they has sufficient energy to remove tightly bound electrons. Collision of electrons with other molecules releases electrons in a reaction cascade referred to as ionization, and this makes them more dangerous. Sources of ionizing radiation. Number 1. X-rays and gamma rays, which are electromagnetic waves of very high frequencies. Next is high energy neutrons, alpha particles and beta particles, which are essentially electrons. About 18% of the total dose of ionizing radiation received by the US population is human-made, originating for the most part in medical devices and radioisotopes. So ionizing radiation is like a two-edged sword because ionizing radiation is indispensable in medical practice for treatment of cancer, in diagnostic imaging, and as therapeutic or diagnostic radioisotopes. However, it is also mutagenic, carcinogenic, and even teratogenic. Now let's see the main determinants of the biologic effects of ionizing radiation. Let's start with sensitivity of proliferating tissues. Tissues with a high rate of cell turnover or replication such as gonads, bone marrow, lymphoid tissues, and the mucosa of the gastrointestinal tract. Vascular damage. Damage to the endothelial cells which are moderately sensitive to radiation. This may cause narrowing or occlusion of the blood vessels, leading to impaired healing, fibrosis, and chronic ischemic atrophy. Rate of delivery. The rate of delivery significantly modifies the biologic effect. The effect of radiant energy is cumulative, but delivery in divided doses may allow cells to repair some of the damage in the intervals. Hypoxia. Ionizing radiation may directly damage DNA, which is termed as direct target theory. But more often, it does so indirectly by producing free radicals from the radiolysis of water and interaction with molecular oxygen, which is termed as indirect target theory. Therefore, hypoxic tissues are relatively resistant to radiation injury. This oxygen effect is significant in the radiotherapy of neoplasms. The center of rapidly growing tumors may be poorly vascularized and therefore somewhat hypoxic, making radiotherapy less effective. Field size. The size of the field exposed to radiation has great influence on its consequences. The body can sustain relatively high doses of radiation when they are delivered to small, carefully shielded fields, whereas smaller doses delivered to larger fields may be lethal. Now let's move on to DNA damage and carcinogenesis. The most important target ionizing radiation is DNA. So this kills the dividing cells. Mutations and chromosomal abnormalities may occur. Ionizing radiation can cause many types of damage in DNA, including base damage, single and double strand breaks, and cross-links between DNA and protein. Repair systems are linked to cell cycle regulation through the activity of genes such as ATM gene that initiate signal transduction after the damage and thereby activating P53, which is also known as the guardian of gene, which can transiently slow down the cell cycle to allow for DNA repair or trigger apoptosis of cells that are irreparable. However, double-strand breaks may persist without repair, or the repair of the lesion may be defective, creating mutations. If cell cycle checkpoints are not functioning, cells with abnormal and unstable genomes survive and may expand as abnormal clones to eventually form tumors. Radiation and fibrosis. The development of fibrosis in the tissues included in the irradiated field. Fibrosis may occur weeks or months after irradiation, leading to the replacement of dead parenchymal cells by connective tissue and the formation of scars and adhesions. Ionizing radiation causes vascular damage and consequent tissue ischemia. Vascular damage, the killing of tissue, stem cells by ionizing radiation, and the release of cytokines and chemokines that promote the inflammatory reaction and fibroblast activation are the main contributors to the development of radiation-induced fibrosis. So as I told, the ionizing radiation results in DNA damage. It may be through direct effect or through indirect effect by forming free radicals. So the DNA is damaged. Sometimes it may be able to repair and the tissue reconstitution takes place. Otherwise, there will be failed or aberrant repair, and this may result in cell death due to inhibition of cell division, or in other cases, the aberrant repair results to teratogenesis or carcinogenesis by additional transforming events. Now let's see the morphology. There may be structural changes in chromosomes including deletions, breaks, translocations, and fragmentation. The mitotic spindle often becomes disorderly and ploiploidy, and aneuploidy may be encountered. Nuclear swelling and condensation and clumping of chromatin may appear. Sometimes the nuclear membrane even breaks. Apoptosis or cell death may occur. All forms of abnormal nuclear morphology may be produced. Giant cells with pleomorphic nuclei or more than one nucleus may appear and persist for years after exposure. At extremely high doses of radiant energy, nuclear pycnosis or lysis appears quickly as a marker of cell death. Cytoplasmic changes. In this, we may be able to identify cytoplasmic swelling, mitochondrial distortion, degeneration of the endoplasmic reticulum, and even sometimes plasma membrane breaks and focal defects may appear. The histologic constellation of cellular pleomorphism, giant cell formation, changes in nuclei, and mitotic figures creates a more than passing similarity between radiation-injured cells and cancer cells. A problem that plagues the pathologist even evaluating post-irradiation tissues for the possible persistence of tumor cells. Light microscopy. Vascular changes and interstitial fibrosis are prominent in irradiated tissues. During the immediate post-irradiation period, vessels may show only dilation. Later, or with higher doses, a variety of degenerative changes appear, including endothelial cell swelling and vacuolation, or even dissolution with total necrosis of the walls of small vessels such as capillaries and venules. Affected vessels may rupture or thrombose. Still later, endothelial cell proliferation and collagenous hyalinization with thickening of the media are seen in irradiated vessels, resulting in marked narrowing or even obliteration of the vascular lamina. At this time, an increase in interstitial collagen in the irradiated field usually becomes evident, leading to scarring and contractions. So here you can see the central lumen is completely occluded by the thrombus, and due to the intimal proliferation, the thickened vessel wall can also be appreciated. So this is nothing but the chronic vascular injury with subintimal fibrosis which occludes the lumen. This is acute vascular injury with fibroid necrosis and edema after exposure to ionizing radiation. This is nothing but the edema, and this is the fibroid necrosis, and this one right here is the occluding thrombus. Total body irradiation. Exposure of large areas of the body to even very small doses of radiation may have devastating effects. Higher levels or exposure cause health effects known as acute radiation syndromes, which at progressively higher doses involve the hematopoietic system, gastrointestinal system, and even central nervous system. Now let's learn the effects of organ systems. The most sensitive organs are the gonads, the hematopoietic and lymphoid systems, and even the lining of gastrointestinal tract. This table right here shows the estimated threshold doses for acute radiation effects on specific organs. For example, different doses in sieverts are given to different organs. In case of testis, 0.5 sieverts of radiation is given, and when it's exposed to that radiation, it results in temporary sterility. Whereas if the dose is high, for approximately 3.5 sieverts, it results in permanent sterility. Likewise, bone marrow is when exposed to 0.5 dose of radiation, it results in depression of hematopoiesis. Skin, when exposed to 1 to 2 range, it results in reversible skin defects such as erythema. When the skin is exposed to even higher ranges like 3 to 5, it results in temporary hair loss. In case of lens of eye, when it is exposed to 5 sieverts of radiation, it results in cataracts. Now this table here shows the effects of ionizing radiation. Main site of injury and main signs and symptoms are discussed. For example, the lymphocytes, when is exposed to 1 to 2 sieverts of radiation, it results in moderate granulocytopenia and lymphopenia. Whereas higher doses like 2 to 10 sieverts, when is dealt with bone marrow, it results in leukopenia, hemorrhage, hair loss, and vomiting. Even higher doses like 10 to 20 range acts on small bowels. It may result in diarrhea, fever, electrolyte imbalance, and vomiting. Very much higher, like more than 50 sieverts, can affect the brain and results in ataxia, coma, convulsions, and vomiting. All these are time dependent and duration of the exposure. So as I told, different organs are affected from brain to gonads, and in adults the brain is resistant because there is not much proliferation seen in brain, whereas in embryonic stage it results in destruction of neurons and glial cells. Skin may be resulting in erythema, edema, dyspigmentation, atrophy, cancer, etc. Lungs also results in edema, ARDS, which is acute respiratory distress syndrome, and interstitial fibrosis. Also, in lymph nodes, it may result in acute tissue loss, atrophy, and fibrosis. The gastrointestinal tract may cause mucosal injury, ulceration, and fibrosis of walls. Then gonads, blood, and bone marrow will be affected. Hematopoietic and lymphoid systems. These are extremely susceptible to radiation injury. With high dose levels and large exposure fields, severe lymphopenia may appear within hours of irradiation, along with shrinkage of lymph nodes and spleen. Radiation directly destroys lymphocytes both in circulating blood and in tissues. The circulating granulocyte count may first rise but begins to fall towards the end of the first week. Levels near zero may be reached during the second week. If the patient survives, recovery of the normal granulocyte count may require 2 to 3 months. Platelets are similarly affected, with the nadir of the count occurring somewhat later than that of the granulocytes. Recovery is similarly delayed. Hematopoietic cells in the bone marrow, including red cell precursors, are also quite sensitive to radiant energy. Erythrocytes are radioresistant, but anemia may nonetheless appear after 2 to 3 weeks and persist for months because of bone marrow damage. Esophagitis, gastritis, enteritis, colitis, proctitis, etc. These are associated with exfoliation of the epithelial mucosa, susceptibility to infection, and loss of electrolytes and fluid. Delayed injury to small blood vessels causes chronic ischemia, ulceration and atrophy of the mucosa, and fibrosis that can cause strictures and obstruction. Skin. Hair follicles and the epidermis are sensitive. Desquamation can occur, resulting in replacement of the normal epidermis by atrophic epidermis characterized by hyperkeratosis, hyperpigmentation, or hypopigmentation. The subcutaneous vessels may be weakened and dilated. They are surrounded by dense bands of collagen in the dermis. Impaired healing, increased susceptibility to infection, and ulceration may occur. These changes are called radiation dermatitis. Basal cell and squamous cell carcinomas may occur as long as 20 years after exposure. So, here we can appreciate chronic radiation dermatitis with atrophy of the epidermis, dermal fibrosis, and telangiectasia of the subcutaneous blood vessels. This is the epidermis, and this right here is the thrombus blood vessels in the dermis level. And here you can appreciate the collagenous bands. Breast. Diagnostic doses of ionizing radiation administered during adolescence increase the incidence of breast cancer after 15 to 20 years. Radiotherapy for breast cancer causes a dense fibrotic reaction with extreme pleomorphism of epithelial cells. So, radiation fibrosis of the breast trauma after radiotherapy for infiltrating ductal carcinoma. The nest of remaining tumor cells are pleomorphic and multinucleated as well. So, this right here is the pleomorphic tumor cells. Environmental exposure and cancer development. Any cell capable of division that has sustained a mutation has the potential to become cancerous. Thus, an increased incidence of neoplasms may occur in any organ after exposure to ionizing radiation. The level of radiation required to increase the risk of cancer development is difficult to determine. Sublethal but relatively high doses are clearly associated with an increased risk. This is documented by the increased incidence of leukemias and tumors at various sites in survivors of atomic bombings of Hiroshima and Nagasaki, in the increase in thyroid cancers in survivors of the Chernobyl accident, and also in residents of Pacific Islands exposed to nuclear fallout. Now let's move on to occupational exposure and cancer development. Radon is a ubiquitous product of the spontaneous decay of uranium. The carcinogenic agents are two radon decay byproducts, which emit alpha particles and have a short half-life. These particles are deposited in the lung, and chronic exposure in uranium miners have given rise to lung carcinomas. Ultraviolet radiation. Solar radiation. Ultraviolet, visible and infrared radiation. Ultraviolet radiation is divided into ultraviolet A, ultraviolet B and ultraviolet C. 3% to 5% of the total solar radiation that penetrates the Earth's surface is ultraviolet radiation. Ozone. It completely absorbs all ultraviolet C and partially absorbs ultraviolet B. Chlorofluorocarbons used commercially as propellants, as solvents, and in refrigerators and air conditioners interact and deplete the ozone. Such depletion is predicted to contribute to increase in UVB and possibly UVC exposure, thus triggering a 2 to 4% increase in the incidence of skin cancer. Some protection from the effects of ultraviolet light is afforded by window glasses. They absorb UVB radiation, but they transmit UVA radiation. Sunblocks and sunscreens offer greater protection because they absorb and block ultraviolet B and ultraviolet A to variable degrees. Hope you have understood the video. Like, subscribe and press the bell button for more videos. Thank you. Thanks for watching.